Hello and welcome to Medical Dialogues. I am Dr. Nandita Mohan. Let's look at today's top headline. Recent study reveals long COVID severity may be similar to flu. Having recorded a consistent rise in COVID cases, the research supports the manifestation of seasonal influenza with it. According to this new research, long COVID appears to manifest as a post-viral syndrome of no greater incidence or severity than the seasonal influenza. However, the similarity observed is only valid for people who are vaccinated, according to the study being presented at this year's European Congress of Clinical Microbiology and Infectious Diseases that was held in Copenhagen, Denmark between April 15th to April 18th. The study by researchers at Queensland Health in Australia suggests that despite the similarity of clinical outcomes after COVID-19 and influenza, long COVID's impact on public health systems is likely to stem from the volume of those infected with SARS-CoV-2 rather than the severity of long COVID symptoms. During concurrent waves of Omicron and influenza that occurred in mid-2022, 2,195 adults diagnosed with COVID-19 and 951 adults diagnosed with influenza were followed for 12 weeks and asked about ongoing symptoms and functional impairment using a questionnaire delivered by SMS linked to a survey. At the time, more than 90% of the population of Queensland had been vaccinated against COVID-19. Of those diagnosed with Omicron, a fifth reported ongoing symptoms at 12 weeks, and 4% reported having moderate to severe functional limitations in everyday life. Similarly, around a fifth, that is 23% of adults diagnosed with influenza reported ongoing symptoms and 4% reported moderate to severe functional limitations. The analysis found no evidence to suggest that adults with Omicron were more likely to have ongoing symptoms or moderate to severe functional limitations at 12 weeks after their diagnosis than adults who had influenza. Interestingly, the analysis suggests that younger age groups and non-indigenous populations were more likely to report moderate to severe functional limitations after influenza than Omicron. The study also has several limitations, including that it was an observational one and can't prove causation, and it can't rule out the possibility that other unmeasured factors such as underlying illness and influenza vaccination status may have influenced the results as well. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.